I think the first thing I would say is ask questions. Ask questions not only about the seizures, but triggers and lifestyle changes that could influence both seizure treatment and side effects. So one of the things that we see with patients going off to university is that it's the first time they have a bit more freedom, and with that, sometimes they might get a bit excited with so much to do, but they may end up forgetting to take their medications, or which is what we call the perfect storm when they stay late studying or partying, and then have to get up early to go to school or to do a test. So the combination of sleep deprivation, alcohol, and sometimes forgetting the medication is the perfect storm to trigger seizures. So I think we always tell patients, be very careful, prioritize your sleep. Sleep is very important. And even though it's the last thing students want to hear about, it's still very important, especially for people that have epilepsy. There are readiness questionnaires which evaluate the readiness of a person to move from the pediatric to the adult care. And it's a questionnaire that will help the patient identify the areas where he or she needs help, as well as the healthcare team. Because sometimes you think your patient is well versed in this or that thing, and turns out they are not, and they might need help with other things as well. So, like calling for refuse, calling for informing side effects of medications or what to do. So the readiness questionnaire is one tool that is very helpful during the transition. There are several challenges. I think one of them is coordinating all the specialists that the person is seeing. So not rarely you're going to have a person in pediatric care seeing the neurologist, a psychiatrist, sometimes a physiatrist. And when they move to the adult side, they only have the neurologist. And so they might lose the other specialties. So it's very important to try and coordinate and get the pediatric specialist find its counterpart in the adult side. The other issue is just a different system, and sometimes not all the information is properly transferred. So that's why we say the transition would be ideal, because then you, in addition to prepare the patient, you prepare all the documentation that the new physician is going to need. So sometimes just, copying and sending the whole chart can be challenging, because the new neurologist only has a short amount of time to see the patient and cannot look at 18 years of medical history. And again, the epilepsy transition forms are very useful on this sense. Other challenges that we see are with more rare forms of epilepsy that are mainly the domain of child neurologists, so the adult neurologists might not be so familiar with. But the knowledge is getting out there, so there are more and more papers and more studies about the long-term outcome of childhood onset epilepsy, especially genetic epilepsies. Well, I guess regarding the back to school is communication is essential. If you ideally, you should be able to talk to the child neurologist who is referring the patient to you, and vice versa. So that kind of collaboration is always very helpful.